Welcome back, guys. This week we're talking about addiction, a topic that, guess what, not a lot of psychologists know anything about. And it makes sense that they don't know anything about addiction because we need to first understand what emotions are and how they operate to really understand the deep fundamental cause of addiction. I mean, look at what the DSM says about addiction. It's a list of 11 or 12 things, signs, symptoms of addiction. And if you have 2 of them, then you might have kind of a problem. If you have 4 or maybe 6 of them, then it's a full-blown addiction. It's one of those things. But they're just, again, symptoms. They don't talk about the cause of addiction. And there's definitely no definition of what addiction even is. And look at some of those symptoms. They're not even that big a deal, like withdrawal symptoms, building up a tolerance to whatever substance it is. Well, who hasn't built up a tolerance to alcohol and had some sort of hangover? So there's 2 right there. So now you have some sort of substance use issue because you build up a tolerance to alcohol. You can drink more than 4 beers and you can get a hangover sometimes. It's ridiculous. And it's going to be ridiculous because nobody understands what emotions are, so we can't define what addiction is, but that's what I'm going to do right now. Addiction is... being really annoyed by that sound. No, addiction is when we remove ourselves, when we try to decrease unconscious pain, and we do it automatically outside of our control with some sort of substance or activity outside of us, whether that's alcohol, whether it's any sort of drug, whether it's way too many Oreos. These are all forms of addiction. And when we no longer have willpower to stop using that thing out there that we use to disconnect ourselves from our unconscious emotional pain, when the willpower is no longer a factor, or it's no longer effective, then it's an addiction. Now there's different degrees, right? Just like there's 4 different ways we can manage our emotions: mature, immature, neurotic, and do neurotic enough, we get psychotic. There's 4 different, I guess you could say, levels to addiction. The first one is really not addiction at all. It's just fun. You like drinking because it's fun. It's a fun thing to do with your buddies. It leads to a lot of interesting things like panty raids. Well, according to movies about college from the 80s, it leads to panty raids. But when you're at this first stage, then you can stop whenever you want. You're just doing it solely for the fun of it, not to remove any pain. However, when we get into the immature way of addiction, or handling the immature form of addiction, then we begin to start covering up. This is partially conscious, partially unconscious. There's like a base level of anxiety there that we can't really seem to manage on our own, and it may even just be accepted. We may accept it as part of existence, but it's really part of our psychology. It's a part of our anxiety that we don't know how to manage because up until now, nobody's really shown you how to manage anxiety. For more information on that, go and check out the lectures I did a little bit ago now about these maps. Maybe I'll put a link in there, see if that works this week. But yeah, this is covering up. But you can still say no. You can still stop. You don't really want to stop. If you're halfway through the sleeve of Oreos, you could stop. But you really want to eat the rest of those Oreos because it feels really good. Yeah, I mean, that's the thing with alcohol is why do we feel more alive and energized when we're drinking? Alcohol's a depressant. So why would we feel more alive? Well, we feel more alive because it removes the anxiety. The third is an automatic cover-up. Now we're getting into what real addiction is. This isn't really addiction, and I would guess most of us are here at number 2. If we have any sort of what we would call a problem with a substance or Netflix or whatever it happens to be, we're probably here, most likely, or most of us. But this is when the willpower is no longer effective. We're covering up unconscious baggage, but we can't stop. This is when it's time to go seek treatment before number 4 happens, where it's automatic and you're unaware that you're doing it. And I've seen this happen people will quite literally wake up in their living room with a bottle of booze in their hand, and they'll think, how in the heck did I get here? Not only is it automatic, but it is now unconscious. And this is when it really gets scary. And you're probably not going to be at 3 or at 4, maybe even 3, unless there was some serious physical abuse or sexual abuse when you were a kid. Other than that, you're probably going to be here. So this is addiction. This is how we understand it. And it's only when we understand what addiction is can we figure out how to manage it. Like we talked about before, get in touch with the unconscious. Specifically with anxiety, you look at the threats coming in, and instead of avoiding them, and if you avoid enough threats, it will build up and you will become addicted to something. It's not a question of whether you will become addicted. You will. It's just a question of what will be your addiction. Some people, for whatever, most likely a genetic reason, more likely to be addicted to alcohol. Other people, more likely to be addicted to opiates. Other people, more likely addicted to food, But if you avoid anxiety enough, it will build up. And look at, what do we say about OCD? I can't, but I have to. That is the implicit thought behind every OCD, behind accumulated anxiety. And that's exactly the relationship with addiction. Or that's what causes addiction. This is here. I can't, but I have to. It's no longer in your willpower. I can't, but I have to. But this I can't, but I have to applied to addiction is I can't stop drinking, but I have to drink. There's something inside me has to drink. It's not to feel pleasure like we talked about last week. It is to avoid pain, specifically the pain of anxiety. And that's really the cause of most addictions. Now, people with addictions have anger problems too, but anger problems don't cause it. The anger problem, you're angry with yourself because you're caught in this unconscious loop of I can't, but I have to. And you go to a treatment center and nobody shows you how your emotions work. So you're sort of left to figure it out for yourself. And we wonder why we have all these drug problems, opiate crisis, whatever. To the extent that it is a crisis, I'm not really sure. So we bring up the unconscious, get in touch with what's going on, and we ask ourselves, what threats are we avoiding? And we confront those threats in the best way we can. 95% of that time, a confrontation of a threat is going to be a conversation. And 95% of that conversations, of course, is going to be a conversation with your mother or father or that which they represent. Intimacy and authority, respectively. This is group, this is meditation, this is sitting still, this is creating secure attachments, being honest about who you are with the faces right here, getting ever more aware of the structure of your mind and what is causing your behavior. And I think when you do that enough, any sort of addiction you have, again, you're most likely here at number 2, but you may even be at 3 or 4. It'll just go away. You won't try to stop. You will stop it naturally. But even if you don't have an addiction, a full-blown addiction, like I said, most of you are right here, and I mentioned before, there's just this strata of anxiety that a lot of us just represent or just have become accepted to, have become accustomed to. I'm talking here. We become accustomed to the strata of anxiety, and we can't really do anything about it. The only thing we can do is cover it up in any way that we can, whether it's booze, sleeves of Oreos, ice cream, Netflix, or maybe just YouTube. Maybe you're avoiding something right now. Are you addicted to YouTube and that's what you're doing right now? Well, close down. Well, first like and subscribe to this channel. Then close the laptop, get out and start talking with people. Seek treatment if you have to. And then you will realize that what is ultimately causing your addiction is your desire to get out of yourself.